The tooth survival of non-surgical root-filled posterior teeth and the associated prognostic tooth-related factors. A systematic review and meta-analysis by Patel et al. Published in the International Endodontic Journal in 2024. The survival of a root-filled tooth refers to whether the tooth is present or has been extracted, and differs from success, which refers to healing of apical periodontitis. Generally, patient prefers to know after receiving reassurance of pain resolution how much longer a tooth can be preserved as a consequence of root canal treatment, and therefore whether the treatment is worth it. Posterior teeth are generally considered difficult to treat, both endodontically and restoratively. The biomechanical demands of posterior teeth are usually much greater than their anterior counterparts, mainly due to the extensive daily forces they are exposed to during mastication and, for some other patients, bruxism. They are more difficult to access and complex anatomical variation and more susceptible to caries and cracks, and have multiple cusps and marginal ridge that, if lost, can reduce the tooth stiffness. Therefore, the aim of this systematic review were to investigate the survival rate of non-surgically root-filled posterior teeth and to identify the tooth-related factors that affect the survival. Of the 72 studies identified, data from 20 studies were included in the survival meta-analysis, and data from 13 of these studies were included in the descriptive analysis of tooth-related factors. 12 studies were retrospective, 7 were prospective, and only 1 was a randomized controlled trial. The pooled survival rates at 4 to 7 years, which considered medium follow-up, was 91%, and the long-term follow-up was from 8 to 20 years was 87%. The prognostic tooth-related factors mentioned in the study included was remaining coronal tooth structure, furrow, crown-to-root ratio, tooth type and location, periodontal disease, proximal contact, and crack. So, this meta-analysis suggests that root canal treatment has high, medium to long-term survival outcome. However, this study results are variable, providing long-term data on the tooth survival and offering insight into the prognostic factors that clinicians should consider when planning endodontic treatment. However, these findings particularly relies on retrospective data, which can lead to exaggerated effect due to the large sample size and inability to clinically assess the teeth directly